Low-dose aspirin, a blood-thinning medicine, isn't suitable for certain people. Nonetheless, most people aged 16 or over can safely take low-dose aspirin if their doctor recommends it. There is a possible link between aspirin and Reyes syndrome in children, according to the NHS. Reyes syndrome is a very rare illness that can cause serious liver and brain damage. If it is not immediately treated, it may be fatal. Reyes syndrome mainly affects children and young adults under 20 years of age. Pfizer booster shot, the side effect reported in 83% of people. Initial symptoms can include repeatedly being sick, tiredness and fits. As the condition progresses, the symptoms may get more severe and can include confusion that's sometimes associated with hallucinations. The exact cause of Reyes syndrome is unknown, but it most commonly affects children and young adults recovering from a viral infection, such as a cold, flu or chickenpox. In a lot of cases aspirin has been used to treat their symptoms, which is why it is thought aspirin may trigger Reyes syndrome. Hypertension diet, eating just a teaspoon of this can slash risk. Tips: longevity, the simple exercise that lowers risk of mortality by 70%. Tips: Parkinson's, 2 lifestyle behaviors that more than double your risk. Advice: so if after having a cold, flu or chickenpox, your child is showing these symptoms, report them to their GP. Tell your GP if your child has taken aspirin, but even if your child has not taken aspirin, Reyes syndrome needs to be ruled out. In Reyes syndrome, it's thought that tiny structures within the cells called mitochondria become damaged. Mitochondria are important for the healthy functioning of the liver. If the liver loses its energy supply, it begins to fail. This can cause a dangerous buildup of toxic chemicals in the blood, which can damage the entire body and can cause the brain to swell. Although Reyes syndrome is serious, the majority of children and young adults who develop it will survive, and some will make a full recovery, according to the NHS. Moreover, even though a number of studies suggest a link between the development of Reyes syndrome and the use of aspirin, it has not been proven to be the sole cause, according to the National Reyes Syndrome Foundation UK charity. These studies did not prove that aspirin is the only cause of Reyes syndrome but showed that it can precipitate it in the presence of other factors such as a viral infection and possibly some innate susceptibility, the website states. Because there are alternatives, there is no need to use aspirin for feverish illnesses in childhood, the charity says. Treatment aims to minimize the symptoms and support the body's vital functions, such as breathing and blood circulation. It is also essential to protect the brain against permanent damage that can be caused by the brain swelling. In adults, low-dose aspirin may be suggested if you have had a stroke or a heart attack to help stop you having another one. For adults, aspirin is also an everyday painkiller for aches and pains such as headache, toothache and period pain.